Hi everyone, welcome to researchmd.com where we bring the scientific evidence to you. So today we're going to look at the non-alcoholic fatty liver disease and the association with the lung cancer. Again, my name is Pramil Cheriyath and I'm a physician, and I also work as a program director, internal medicine residency program, transitional residency program. I got a master's in clinical research, and I'm also an assistant professor of medicine at Hackensack School of Medicine. So let's go into our topic and see what's our results show. So when you talk about non-alcoholic fatty liver disease, it's the accumulation of fat on the liver cells, and it can kind of lead to like a lot of complications. Most of the time you go to a physician's office and they might did an ultrasound and they said like, hey, you got fat on the liver, and you always kind of wonder, what does that mean to you, right? Is it something I need to take it very seriously, or should I be concerned about it? So before we go further, there's two terms we need to understand. One is the non-alcoholic fatty liver disease, which is actually, there is only like fat deposition, nothing else happening. There's fat kind of coming onto the liver. Maybe, when we talk about early stages. Then you have another term called NASH, which is non-alcoholic steatohepatitis. This is where the problem comes in. You got fat. What does it do? It causes inflammation, and there is tissue damage, and you don't want the tissues kind of damaged in the liver, correct? So we're going to look at the study published in one of the major journals, and so we're going to go and see like what is our relationship. So, our objective of this, not our objective, the objective of the study is looking at the association between non-alcoholic fatty liver disease and the liver cancer. So which method they used, or where did they get the database? You have this huge database of the European Medical Information Framework. Consists of several data sets. They pulled their data together. Several European countries were involved. Health search data, integrated primary care information data, information system for the development of the research and primary care data, and health information network. So they combined all these people, and look at the amount of people in this study. You have like 18 million people in the study, okay? So large number of patients. So what did they do next? So out of this 18 million, they just looked at the people only diagnosis with a non-alcoholic fatty liver disease, or non-alcoholic and non-alcoholic steatotic hepatitis. Okay, there's 136,703 people, 0.7%, and then they did the analysis. So they followed up the people. The average follow-up period was like 5.4 years. Okay. Now let's look at the results for the liver cancer. When you look at it, this is like when you look at it's a ratio actually, hazard ratio. Anything greater than 1 is important, and you don't want to include 1. Since it's a ratio, if it is 1, if it includes 1, it's not significant. So anything greater than 1. So in this diagram, you can see everything kind of on the right side. When you look at the diamond, it's that the pooled information kind of together, okay? So one other way, when you have a picture like this, you can always see the confidence interval. You have to pay very close attention to the confidence interval. The best studies are with the narrow confidence interval. Okay, that give you like a lot of information. That tell us there is less variability. Otherwise, when you see a large confidence interval, then you have to say like maybe the data is like more variability, which is not that good. So if you look at it, you look at the look at the diamond, and then see like how far is kind of on the right side, right? So when they did all the analysis, the risk for liver cancer, you can see hazard ratio is like 8.02. That means you have almost like 700% more likely to have liver cancer when you have a non-alcoholic fatty liver like NAFLD or NASH, right? So, what are the other factors associated with the development with the lung cancer? They looked at some of the factors. So, if you have diabetes, your risk is higher. Remember that. And if you have, if you have, that depends upon the age. The older you are, we know when we get older, there's increased risk of cancer, right? Same thing with the diabetes and age. Those are two factors kind of associated with the development of liver cancer when we talk about NAFLD and NASH. Remember that. Fatty liver disease, if it is associated, if you are older and if you got diabetes, you're more likely to get cancer. Remember that, okay? So the strength of the study when it's a large number of participants, anytime you see a large number, I think it's really kind of tell you the data in so many different ways. There's no pharmaceutical funding, right? A lot of other studies we see, there's always pharmaceutical funding involved. There is matched cases controls very well. So what's our conclusion? This study clearly says that fatty liver disease is associated with a risk of developing liver cancer. So we have to take this more seriously, and then we'll make more videos about the presentation, what measures we can take to decrease the chances of having fatty liver disease and liver cancer. Thank you very much for watching. Thank you.